Hi, everyone, and welcome to today's author interview. I am so happy to be here. My name is Dr. Tammy Nelson, and I am the author and editor of Integrative Sex and Couples Therapy, a therapist's guide to new and innovative approaches. And I'm thrilled to have my author here, my co-author here, Gail Guttman. She is a licensed clinical social worker, a certified sex therapist, a sex therapist supervisor. She's also a certified sex and couples therapist and one of the primary faculty members at Integrative Sex Therapy Institute. It's just a lot to say because you have so much going on. You have so many credentials and you do so much. And all of them have to do with sex and couples therapy because you're like a primary expert and you practice down around the Washington, D.C. area. And I know now you're teaching at another university as well.
Yes, I am. I'm teaching in the Master's in Marriage and Family Therapy program, a class on couples and sex therapy for master's students. Yeah, that's great. Fabulous. It's great.
You're such a good teacher, and you are a great writer. I love these chapters. They're really valuable. We're going to talk about them in a second. But first, welcome, Gail, my dear friend and very respected colleague.
Thank you. Thank you.
I'm really excited actually to have you here to talk about your chapters. You wrote 2 chapters in the book, chapter 1 and chapter 5. Chapter 1 because it's super important what you wrote. It sort of sets up the whole foundation of the book. It's sex and couples therapy, biopsychosocial and relationship therapy. So you really talk about the whole history of sex therapy and how it relates now to using it integratively with relationship therapy. So it's great, brilliant. And then you also talk in chapter 5 about IFS, which is internal family systems and sex therapy, which is a type of couples therapy. So I really am thrilled to talk to you today because you are just a wealth of information. You've been doing this for a long time. You're super experienced, and you really are a model in how to integrate relationship therapy with sex therapy.
Thank you.
You're welcome. And you're a fabulous teacher. The students come to your class absolutely love you. You're very good at taking information and integrating the information so that people can understand it at all levels, whether you're a beginner or an expert or an advanced therapist, or you're there for your own case information to get interventions, or even for your personal life. You're a good therapist. And so we're really lucky to have you today, and I'm just thrilled to talk to you.
Thank you, Tammy.
You're welcome. So tell us a little bit more about like why you wrote these chapters, what your sort of theoretical model is, or your belief in this idea of sex and couples therapy.
Well, I became a sex therapist when I was very young, and it was in I have to say the 1980s. And at that time, sex therapy was a cognitive behavior kind of therapy. And I did that for a while. And then I must say, I know plenty of people that do cognitive behavior therapy, and I think like that's great. But for me, I got kind of bored. And so, and I was always working with couples at the same time. And then I found imago therapy, and I did a whole bunch of imago therapy. And as you had, I did a whole bunch of imago therapy training for a bunch of years. And then I kept thinking along the way, these things are not going together. And we need to really start to address that. And so that probably happened like 15 years ago. And because what has always bothered me is that sex therapy used to really teach very little about couples therapy, and couples therapy programs are saying very little about sex therapy. And if they are, they don't really know. It's a really, really big problem.
Yeah.
And then, of course, you came to me, I think it was like 2014 or 15, around sort of talking about doing more education in that way. And it was something that the two of us both really resonated and had a passion for it. And so I wanted to write the chapter because I wanted people to understand that sex and couples therapy are really important, and that we need to be able to talk about sex when you're a couples therapist, and that when you're a sex therapist, you need to understand what's happening in relationships. And I wanted people to understand that it's complex, and that it isn't a simple thing.
Yeah.
So,
and in your chapters, you really took it from a lot of different angles. Like you can really work this from a lot of different theoretical models, and you've studied with a lot of different practitioners. And so you really took a lot of the approaches and took all of your background and all of your education in sex therapy and said, you can do sex therapy and use other kinds of couples therapy.
Right. Well, I really do believe that. I really think that, the ones I wrote about were emotionally focused therapy and internal family systems with couples and Margo. But I absolutely believe that sex can totally be a part of all of those. And I think I gave an example of a particular case that you could look at through all three of those windows. And I think that that's a really important thing to do, to be able to, that it doesn't matter what kind of couples therapy you do, but it does matter that you're doing couples therapy, which is about relationships, because couples therapy is, the client is the couple, not the two individuals. And that's a really different thing than I think how we normally would think about couples. And so these are all models that really do look at, I'm working with my client is the couple.
Totally. That's a great point. And so, when you're writing this chapter, did you feel like, oh, it's so interesting to just compile these years of experience that I have and this years of information and to see it written down and sort of, look at it as a whole or a gestalt? Did you notice anything as you were writing? Did anything come up for you? Was there something that you learned just from the experience of writing it?
Once I got started, it was hard for me to get started. I was really happy to do the chapter because I'm passionate about this. And it was nice for me to be able to get it out there. I never felt, particularly in the first chapter, I never felt challenged in doing that, because it's in my being, it's in my fabric. It's all of that stuff is just easy to say off the top of my head. And so that it was easy to write the first chapter. The chapter on internal family systems and sex therapy was a little more challenging for me because I'm newer to that. I've been, dabbling in that for about 4 years. And so that I really was, I learned a lot in the process of really thinking about internal family systems and how we could really use it in sex therapy.
So can you just tell us, just really briefly, what are those three types of couples therapy for people that are listening that might not know?
So the three types of couples therapy, I think I said them, was emotionally focused therapy,
Margo and
Margo and IFS. The people that the IFS couples therapy is called intimacy from the inside out. And so so that in those three models, I think as I know both of them, and I've done a little bit of training in all of them, that it is an easy thing to integrate if you know it. But the other thing is that you really have to know the cognitive behavior parts of sex therapy. That you have to know, how to tell people to do sensate focus, for example, or you have to help people know how to look at themselves, look at their genitals and how they touch them. And you have to know those kinds of things. You have to know that the brain is the thing that's getting in the way of their sexuality. There are certain things that are really important to know about sex. And so even if you know, the couples therapy is process work. It's really is about changing the way people relate. And sex therapy is a content kind of therapy. And you have to know the content in order to weave it in whenever you see that opportunity.
Yeah, and so for people who don't know, IFS is Internal Family Systems. It was started by Dick Schwartz. It's a whole couples therapy approach.
Right.
And then EFT is Emotionally Focused Therapy, which is Sue Johnson's model. And Imago Relationship Therapy is Harvo Hendricks' model.
But the thing about IFS in terms of the couples work is that there was a trainer that was working in internal family systems that created this other system, and her name is Toni Herbine Blank, and she created this system called Intimacy from the Inside Out, which the difference between, I think, that and Imago is Intimacy from the Inside Out is the importance of people working on healing internally inside themselves and then working within the relationship. And I think Imago therapy really looks at healing primarily what I would call horizontally between people. And that's how come I went to learned more about the internal family systems thing, because I felt like both were really needed.
Yeah. So
even though, yeah, go ahead. I'm sorry.
No, it's okay. It's interesting that, you can really look at them sort of visually and think about this internal family system as sort of different parts and how they interact. And then, the Imago therapy is the couple. And then when you're talking about EFT, like there's,
I think EFT is thing. Really, I think EFT is very couples oriented too. Yeah.
And I think
very relational.
It's very relational, right? Yeah. I think of sex therapy as sort of a bridge where each person is responsible for their own sexuality, and they learn how to turn themselves off and turn themselves on, and like you were saying, what's going on in their head and what's interfering. And then there's the bridge where they can meet in that relationship.
Right. That's right. I would agree.
Yeah. Yeah. I mean, I really like how you took all of those different theoretical models and made it so clear what the content is that you have to weave in there, what you have to know to be able to talk about sex with people.
Yeah.
Because I think therapists are afraid to talk about sex with people.
I think so too. This is a funny thing. I was talking to one of the people that's in my practice when she first became a sex therapist. She told me that the two hardest words for her to say were masturbation and ejaculation. And so what she did was, when she was in her car, she would say them over. Whenever she was driving, she would say them over. Masturbation, ejaculation, so that she could do it. And I think it's that idea of how hard it is for us to do that. And I think for the most part, when you ask people about the simplest things like what's happening between you sexually or how's your sex life going, it's mostly a relief to people. I mean, sometimes they're embarrassed, but they're happy that, like, in another way, that maybe this could be a safe space that we could talk about this thing that is so taboo and so hard and is the most vulnerable thing we can talk about. It's like you are completely emotionally naked, not just talking about what it's like physically naked, And so I think it's quite a thing to create the safety for them to do it. But first you have to kind of find safety within yourself to really be able to bring it up.
And I think you really model that for people, like how to be really clear and really concise, and also to bring it up really early. Like I tell people, like, ask in the first session, how was your sex life? When was the last time you had sex? How was it? And I think just in the idea that we can be relaxed about talking about sex as therapists to each other as we're doing trainings for therapists, but also to model that for therapists to begin to talk about it right away, gives them that sort of aha moment where they're like, oh yeah, this is important. This is not like something you wait until they bring up. You open the door, and like you said, people are super grateful. They're super relaxed. They're like, oh, thank God we can talk about this.
Yes, I totally think so. I think that's completely right. Mm-hmm. And I think that I do a number of supervision groups in person, when used to be in person, and online. And I think that's the biggest thing that people get in some ways, those that aren't sex therapists, is just ask, just talk about it. And let's give you some information so you can just begin to talk about it, versus like pretending that it's not there. Or I think one of the weird things, I don't mean to say anything bad about people, is people refer to me for, they've been working with a couple and they refer to me to do sex therapy, and I call them up and I tell them, I really appreciate the referral, but I have to tell you, I can't, it's like telling me to do sex therapy without doing couples therapy. It's like we're just cutting off our arm or something. Like I have to do that, and I don't want, it's going to feel like I'm taking your client away, and I don't want to take your client away. but it has to be couples in sex therapy together.
Yeah, absolutely. And I know that you and I are on the same page about that, which is why we started this certification in sex and couples therapy, because I think that's where the whole field needs to go,
Right.
that we need to talk about this stuff. We need to
Right.
do both. Like you said, they're just intimately connected and related.
It's really weird that there haven't been many programs about that. It's like, what's wrong with us?
Yeah. Well,
so I'm really glad.
We're pioneers in the field.
Yeah.
And you certainly have been one of the people to give not just therapist advice, but couples advice.
Yes.
And if you could leave our listeners with something or give them a piece of advice, what would you tell them if they were struggling?
The biggest thing I tell people about sexuality is the importance of options. Because we live in a world where we view sex should happen in a certain way. And people come to us where like there's something not working, like, a person is having trouble having erections, and people just keep doing the same thing over and over again, thinking somehow that, that's going to help. I think in the book, and now it's like, what's the definition of insanity? Keep doing the same thing over and over again and get the same results. And so I often think of it as it's like you're traveling along a road and something's not working well, and you just keep traveling down the same road, versus maybe you need to take a left. And then when you take a left, like say, that like somebody is stroking your penis, if it was a man in that case, and somehow it's not working for you, then do something different. Get up and start to, change your position, start to stimulate your partner. But that we don't, and then that might work for a while, and then maybe that's not working, and then we have to take another road. And so to me, that's the most important thing, is that we get out of this view of how sex is supposed to be, versus really inviting many, many, many different options. And rather than people, I have people that when it's not working, like they just stop and get mad at each other and leave the room. And I wrote about one of those couples in my chapter. It's really is, we just have to learn to kind of welcome, I think of it that way, welcome the differences and welcome the options.
And it's such a good sort of example of how to deal with the world today, where we actually kind of have to pivot.
Yes.
Like if it's not working, you're going to have to pivot and figure out something else, whether it's being on Zoom or,
Right.
learning a different way to be
Exactly.
in relationship with each other.
Yes, exactly. It's interesting kind of what we're seeing in our practice about that is that the couples that are coming are those that from being in quarantine are in more distress. And some couples, it seems like they're doing better, and actually that their sex lives are better, and that they're more connected because there's not all the distractions
and the stress of going out to work and all that.
Yes. But I also think that the people that we have been coming to us, that continue to come to us, and the people that are calling us now are people that are in much, much more distress. And it's not distress. It's interesting in our practice. It's not the stress about the pandemic. It's the stress in their relationship that it's like it's put a microscope on it.
Yeah, it sort of brings up what's been underneath,
right,
at the foundation, that maybe they haven't had time to deal with, or now it's
or ignored it.
Yeah,
or ignored it.
They've ignored it.
Yeah, and had other ways to deal with it. So
yeah,
absolutely.
Yeah.
And some people are having better sex lives, and those that are in these no sex marriages it just seems worse and more stressful.
It's struggling. Yeah.
More pain.
So I know this is not necessarily your focus in the chapters, but I know that there's been actually an increase in cyber affairs and people looking outside of their relationship, doing this sort of seeking behavior, perhaps just to distract themselves in many ways.
Yeah.
And some of those people do describe that they're in sexless marriages. I think 62% say they're not having sex.
Yeah.
And that's why they're going outside to look online. And they may not be even seeing these people in person, but just to get some attention or distraction.
It's interesting when you said that. I was thinking about something about the book. And, that in the chapter that I wrote around internal family systems and couples therapy, sex therapy, that they internal family systems talks about two different kinds of protectors, ways that we internally protect ourselves from pain. And one is a manager, which is somebody that tries to control everything. And one, so like a person in sex that sort of tries to control every act to keep them safe in some way. And then there's these firefighters that are trying to numb themselves, like they just don't want to feel anything that's inside. And I was thinking when you were talking about the cyber affairs that those are firefighter parts. Those are parts that are trying to numb them from what's happening in their own home. So they do something, what I would say is more compulsive, not really well thought out, as a way to kind of numb the feelings that they have by being home and things are not going so well.
You would think a firefighter is like a rescuer.
No, it actually is a rescuer of our internal parts, of the parts of us that we don't feel so good about. It's trying to keep those parts from feeling badly.
So can you just say a little bit more about that? Because this is the part that confuses me about IFS.
Okay.
Is sometimes I get confused, like all the parts, and I think I need a map. And it may be just because I start to get a little like foggy, because I think, this is too close to home, and my firefighters are like, don't listen to her, turn her off, fog out, put some steam between you and her. I don't know.
Well, I can't speak for you, Tammy. I think that it's not, there are many, many different types of ways, like as a firefighter, that we would do different kinds of things. But the way I came to understand it is I don't like what I'm feeling inside. And so then I have a part that helps me avoid any of those feelings. And so it could be people that drink too much, or at times just I'm not saying they're alcoholics, but just drinking so they don't feel bad inside. Like, I think there's been some stuff, I don't know about the studies for sure, but that, that more people now that we're in the pandemic are drinking more.
Are you kidding? The wine sales have gone way up.
Right. And those are firefighter parts. Those are firefighter.
So firefighter parts drink a lot, in other words.
They could. And I think it's similar in sex therapy too, that some of what we know of as what's sometimes called compulsive sexual behaviors, it's to numb people. I think there's a story in the book about a client that I have worked with, that from the time he was 18, he sought out sex workers through his own marriage. And that, again, was a firefighter part, because prior to that there was a trauma that happened to him, and it was a big trauma that happened to him. And he began to be with sex workers as a way to numb himself around all the shame that he had about this trauma that happened to him. And then, of course, what happens for a lot of the firefighter behaviors is that the next day the shame is just there again. It's still there. And so, but I think the way I like to think of it mostly is it's a kind of a compulsive behavior. I just did a webinar for the Margo Association in this area, and I was talking about another client of mine who is a sexual pursuer of his wife, and he doesn't ever pay any attention to what's going on in the relationship. So he just pursues no matter what. And again, that's a firefighter, because underneath, what he's protecting is that he doesn't feel lovable and nobody ever really touched him. And, so when he became a teenager, it was like the first time in his life he ever felt like loved was in these sexual encounters as a teenager. So, but he does that in a way, it's another firefighter behavior, because it doesn't pay any attention to what's going on in their relationship. And it's trying to help him so that he doesn't feel bad about himself inside.
Interesting.
Does it make a little more sense to you now?
Yeah, and if they came in, how would you use EFT with them? Like, what would be an intervention that's an
Well,
EFT intervention?
maybe if you were, and maybe you should ask Wendy.
I'm gonna. So we have Wendy Miller, who's another co-author in the book, and she focuses primarily in the book on EFT and sex. But I know you do a little bit of it in this chapter.
Yeah, I think that initially in EFT, as I understand it, would be to look at kind of the dance that the couples do together. Every couple, when they come to our office, we see they take an action to protect themselves, and then their partner takes an action to protect themselves, and it just goes back and forth. And all couples therapy is about that. And they name it differently. You know, EFT would name it as attachment styles, and Imago therapy would name it as coping mechanisms, and internal family systems would call it as parts. So they would unravel the dance, as far as I know, and then they would also try to help the people really speak what are the deeper needs and the deeper feelings underneath, which would be then more connecting between the couple. But I think that's kind of true in all couples therapy, is that we're trying, whatever we're doing, we're trying to help people unravel the dance so they can speak what's really inside of them. And you might think of it as their essence or what's most important to them, so that then they can become connected again.
Yeah, that's beautiful.
Thank you.
And then just before we end, is there one Imago intervention with Imago and sex that you would use? I know we have a whole chapter on Imago as well, and I have a whole book on Imago and sex, getting the sex you want, side commercial. But
it's a great book.
Thank you.
We all use it.
Thank you. But in your chapter, you use some great examples. Is there something you can think of that you want to leave us with?
Well, again, I think in Imago therapy, it's the way I think Imago therapy can be the most helpful in sex therapy is in the notion that healing is relational, and that if so say we're a couple, of course we are in our own way, but
and I adore you, by the way,
and I feel the same, but it's the idea that if you were to, so I think in the, like I'll just use the person that I was just talking about, the male who had so little love when he was younger, that in Imago therapy, we would help his wife to understand that, be more healing to that, be compassionate to that, and that there would be more healing in doing that it would be in what she could say, this is a heterosexual couple, in what she could say to him that he never really heard from his family. And because of the power of being his wife, and also because in Imago, we always think people pick people that have the traits of their caregivers. So, the unconscious mind would think that this is my mother or my father saying this to me, and that would be healing, that kind of horizontal healing for them. So it's not all of the things that are in your book are great ways for people to find their ways back and to develop a more positive sexuality and really engage in sexuality. This kind of thing, I think that Imago offers some healing so that people can do those kinds of things that are in your book.
Yeah, thank you.
Did that make sense?
Yeah, it makes total sense.
Okay.
And if you could leave people with one last thought or tip, especially for during this time when, we've moved from a really acute level of shock around what's happening in the world to more chronic, stressful feelings and behaviors, some exhaustion, some anxiety, difficulty sleeping, like you said before, irritation with our partners.
Yes.
And who knows where we're going to be in 6 months when people might be watching this later on. But I know your tips are evergreen. So anything you want to leave people with?
I think I think there are many different things out there that therapists are suggesting: meditation, mindfulness, exercise, all of those kind of things. In a relational way, I think it's a bigger job,
Mm.
because it's really is about how do we really work with our differences, because the differences are like under a microscope at this point in time.
So true.
And that if we can respect the difference, if we can work to respect the difference, versus so many people come in and they don't want to be married anymore because they don't want to accept the difference.
Mm-hmm.
But I really do feel like that it's a lot about accepting the difference so that you can be connected versus trying to get the person to change.
Yeah, that's great.
Thank you.
Yeah. And so, in other words, you're not going to get your partner to change. That's the bottom line.
The only person you can change is yourself. I love that idea. In internal family systems, they use this notion of called a U-turn. So it's like, in couples therapy, we're always pointing the finger at the other person. Exactly. And they have this shotgun kind of thing. Exactly. And so what they're saying is instead look at where your thumb is pointing and take a look at yourself. Right. And that's a U-turn inward versus what are you going to do for me?
Yeah.
So it's great. Thank you.
That's great advice. I think we have to leave it there because where else can you go?
Okay. Thank you so much, Tammy.
Thank you so much, Gail Guttman, the author of 2 chapters in the new book, Integrative Sex and Couples Therapy. She is a psychotherapist and a certified sex and couples therapist in the Washington, D.C. area. You want to let people know how to find you, Gail, and find out more about you?
Well, our website, my business is called Guttman and Pearl Associates, and the website is GPA, the initials like grade point average, therapy.com. But they don't stand for grade point average, they stand for Guttman Pearl Associates.
I'd give you an A for your grade point average.
Thank you. I'm glad to hear that. Okay.
And if you want to buy the book to find out more about Gail's interventions or more about what is in Integrative Sex and Couples Therapy, you can go to anywhere books are sold, including Amazon. You can also go to Pesci Publishing and Media, or you can find out more at my website, drtammynelson.com. For more on training about how to be a sex and couples therapist, you can go to istitraining.com. That's Integrative Sex Therapy Institute training.com, ISTI training.com. And we'd love to talk to you more about how you too can become a sex and couples therapist. Thank you everybody for listening. And Gail, thanks so much for being here.
Okay. Bye-bye.
Stay safe. Be well.